Good morning, everyone. I'm Dr. Kara Christ, Director of the Arizona Department of Health Services. Thank you for joining us today as we get ready to open a second state-run vaccination site. In just a few hours, people will drive through these bays to be vaccinated against COVID-19. We're marking the occasion by giving the second dose to some of the educators and the state troopers that we vaccinated 3 weeks ago at the opening of the 24/7 State Farm Stadium site. It's my privilege to be here with partners who are making it possible to open this medical facility at Arizona State University's Phoenix Municipal Stadium. They are Major General Michael McGuire, the head of the Arizona Department of Emergency and Military Affairs, Dr. Michael Crow, president of Arizona State University, Monica H. Corey, who is vice president of Legislative and Government Affairs for Arizona Complete Health, which is partnering with the Arizona Diamondbacks and others to staff this site with volunteers. We're also joined by Maria Cristina Fuentes, Director of the Arizona Governor's Office of Youth, Faith, and Family, who will be providing a Spanish language update. We created state-run sites at State Farm Stadium and now ASU's Phoenix Municipal Stadium to add capacity and get even more Arizonans vaccinated. Over the weekend, the State Farm Stadium administered its 100,000th dose of COVID-19 vaccine. And today, that site began giving second doses of the vaccine while still accommodating thousands daily for their first dose. These sites have been built off the best practices of existing vaccination sites currently run by Dignity Health, Honor Health, Abrazo, Banner Health, and Tucson Medical Center. All of these sites are around the state. The vaccinating site that we are opening today has the same capacity as State Farm Stadium operation. But for now, its capacity is limited to around 500 doses per day because of the limited vaccine supply. We look forward to the day when Arizona's vaccine supply allows us to operate this site at full capacity and look towards opening state-run sites elsewhere around Arizona. These state-run sites have drawn attention from other states and from our federal partners as best practice models for mass vaccination. They are a credit to the professionals and volunteers who have worked tirelessly to create and run them. In addition to providing this site, Arizona State University brings its expertise by overseeing the staffing, logistics, and operations at both facilities. Volunteers have been critical to making these state-run sites work. I'm grateful to Arizona Complete Health and the Arizona Diamondbacks for stepping up to provide volunteers to keep traffic moving, check people in, and perform other critical tasks. And if you think State Farm Stadium and this site run with military precision, that's to the credit of the Arizona Department of Emergency and Military Affairs. I'll turn the podium over to Major General McGuire to share what's gone into making that happen.
Good morning, everybody. Thank you, Dr. Christ, for your partnership. As I spoke with you 3 weeks ago, we worked hard as a team to collaborate with community partners out at State Farm Stadium. And for 3 weeks, we've been able to successfully run that up to now. We're over 110,000 vaccines and over 650,000 statewide. Well on our way to our target of getting 3.5 million of our fellow citizens vaccinated by July 1st. As we work through this next opening, I want to say thank you to ASU. Their partnership here and at State Farm has been invaluable. This is a whole of government response. I can tell you Dr. Christ and Dr. Leeper, our state surgeon in the National Guard, told me that the keys to the kingdom is having great pharmacy partners. Walgreens was able to do that for us at State Farm, and we're so happy that Walmart's able to do it here at the ASU facility at Phoenix Municipal Stadium. Additionally, the volunteer groups that were mentioned that help with vaccine registration, all of the things that we need to do to get our most vulnerable and most at-risk populations vaccinated in 1B so we can quickly get into 1C. I just want to say thank you again. I know there's frustration out there with the website. We're continuing to work that issue. For those that want to volunteer, continue to reach out, and we'll figure out a way to integrate you effectively. And we want to quickly move out, as I've said, into the rural and tribal communities to replicate this effort. Our federal partners were able to look at what we did at State Farm last Friday. They looked at some best practices, and it's great to know that Arizona, Maricopa County, Phoenix, and all of our great community partners are a model. And in that same vein of modeling, I'd like to introduce Dr. Michael Crow, the president of ASU, and a great partner and one that models not only how to do great vaccination, but educate the greatest generation coming forward. So, Dr. Crow, thank you.
Thank you, General. What I want to add on behalf of ASU is that we're here to serve. We're here to take our know-how, our people, whatever we've got, and bring it to bear to be of assistance here in the great pandemic. I do want to make sure that everybody understands that this is a long-term thing. What we call the Swiss cheese model will be required. Every tool, testing tools, assessment tools, distancing tools, masking for everyone. Vaccines will be something, this won't be the only vaccine that's required for this virus going forward. And so we're excited to be able to be here, to be able to deploy at the scale necessary, to be able to push this thing back as hard as we can right now to get it back into the control mode. Once it's in the control mode, we're still going to be managing this virus going forward. So over at ASU, we're working with the State Department of Health, working with others to build every tool that we can, every device that we can, every system that we can to help make these things work. I think the thing that I would add, as the General suggested and as Dr. Christ suggested, this is an all-in, everyone level thing. This is a virus that's been introduced to the human ecosystem in a way in which it's going to require us to all work together. If you're not wearing a mask, it means you don't really care about the other people that are around you, period. End of conversation. If you're not getting vaccinated, that means that you're not concerned about whether or not you're going to actually die from this virus. And so we're of the view that you've got to approach this with an open mind, care about other people, engage in whatever's necessary for us to get this back to some level of management so that we can get about our lives. Management is going to require all of us working together. ASU is a part of the team to make this happen. We're excited to be able to be here today to help open this site. Thank you.
Thank you, Dr. Kara Christ, and everyone at the Arizona Department of Health Services for your hard work. Thanks also to all of the great folks at DEMA, having taken a look at all the preparation that's gone into making this effort come to life today. It's been an amazing combination of multiple different agencies and organizations from across the state with DEMA, FEMA, the National Guard, law enforcement, first responders, and our healthcare heroes, and countless others. On behalf of Arizona Complete Health, we're grateful to all of the hard work. We're proud to be part of this partnership, and today we celebrate a partnership that's really an example of public-private partnership coming to life. Arizona Complete Health has teamed up with the Arizona Diamondbacks as one of many of the private partners, here to step up and volunteer our efforts to make this site run smoothly and efficiently. Our mission at Arizona Complete Health is transforming the health of our community one person at a time. As a leader in government-sponsored healthcare services, we're supporting Arizonans enrolled in Medicare Marketplace and Medicaid to get healthy and stay healthy. And part of that effort and part of that mission requires partnerships just like these. Transforming our community's health cannot happen working alone. And so today, our employees from across the state, which number in the several thousands, will be here directing traffic, guiding cars to one station to the other, checking people in, collecting paperwork, and some of our clinical staff also administering vaccinations. Partnerships to keep Arizona healthy take many different forms. So whether you're here at this site or whether you're at home checking in on your neighbor, supporting your local food bank, or sending a simple thank you to your healthcare heroes, that all matters in making a difference in getting us through this pandemic. So we are honored to be part of this team in transforming the health of the community one shot at a time. Thank you.
Thank you, Monica, and we appreciate you and your team being out here to help us with this. Now I'd like to introduce Maria from the Director of the Governor's Office of Youth, Faith, and Family for our Spanish-speaking community.
Thank you, Dr. Crist. Buenos días. Mi nombre es María Cristina Fuentes y soy la directora de la Oficina del Gobernador para Juventud, Fe y Familia. Gracias a todos por acompañarnos mientras nos preparamos para abrir un segundo centro de vacunación estatal. En solo unas horas, este centro va a estar abierto para vacunas. Y estamos marcando la ocasión dándole la segunda dosis a algunos de los educadores y policías estatales vacunados hace 3 semanas en State Farm. Para mí es un privilegio ser parte de este equipo de trabajo que ha hecho este centro posible. Ellos son el general Michael McGuire, jefe del Departamento de Emergencias de Asuntos Militares de Arizona, el doctor Michael Crow, presidente de la Universidad Estatal de Arizona, ASU, Mónica Curry, que representa a Arizona Complete Health, asociándose con los Diamondbacks para asegurar que este centro tenga todos los profesionales y voluntarios necesarios, y en especial a la doctora Cara Crist, quien ha sido una líder extraordinaria para el estado de Arizona en esta crisis. Hemos establecido estos centros estatales en el Estadio State Farm y ahora en el Estadio Municipal de Phoenix, de ASU, para aumentar la capacidad y lograr que más arizonenses se vacunen. Al día de hoy, el Centro de Vacunación de State Farm ha logrado 100,000 dosis de vacuna de COVID. Hoy, el Estado está empezando a administrar la segunda dosis y a la vez acomodando miles de personas que tienen su primera dosis. Este centro de vacunación que estamos abriendo hoy tiene la misma capacidad del centro de State Farm, pero por ahora su capacidad es de 500 dosis al día, debido al limitado número de vacunas que nos ha dado el gobierno federal. Esperamos el día que se aumente el número de vacunas para nuestro estado, lo cual nos va a permitir operar este sitio a plena capacidad y mirar a la apertura de otros centros estatales a través del estado. Mientras marcamos la apertura de esta instalación, cuando sea tu turno, por favor, te exhorto a que te vacunes. Y por favor, continúen con las medidas de mitigación. Usar la mascarilla de tela sobre la nariz y la boca, mantener 6 pies de distancia, lavarse las manos, quedarnos en la casa cuando estemos enfermos y asegurar que si es una persona que no está en nuestro hogar, mantener esa distancia y esa mitigación. Muchísimas gracias.
Thank you, Maria. As we mark the opening of this facility, I'm honored to be able to administer the Pfizer vaccine to this group of K-12 and ASU educators and state troopers. When we're finished vaccinating, our speakers and many of those being vaccinated will be available for one-on-one interviews, and we will return to the podium to take your questions. So please take a moment to reposition while I head over to my other job today. So we should see the 16% increase in Moderna doses this week when we get our new allocation this week for next week. And so that's what we're anticipating. We're anticipating, besides that 16% increase, pretty level dose allocations for the state. The state-run sites run using the Pfizer, which has been primarily reserved for Maricopa County and Pima County because of the stringent storage requirements with it, so that the rural counties get the majority of our Moderna doses. So that increase will go to help them.
That's really good news. The governor was on TV, though, saying that we're at dangerously low supply. Clearly, that kind of language is going to panic a lot of people. I got so many emails right after that. I'm on vacation. I'm on my weekend. I'm getting emails because they heard the governor say that. So, what did he mean by that?
So what we are trying to do is make sure that we are efficiently using the vaccine so that no vaccine is sitting on the shelf. So what we've asked our county health departments to do is to work with their providers to make sure that they're not holding back for second doses, because every week we get allocations for first and second doses to meet the weeks before. And so we really want to start getting the vaccine into the arms of Arizonans. But as we do that, and as we bring sites on, we have to moderate how many doses are at each site so that we make sure we can honor all of the appointments.
You say Arizona too, and that brings up another point that the governor brought up. We have a lot of people who come here in the winter. He's not inviting people to come to our state to get the vaccine, but I assume he means we need more because of that. Can you expand on his comments to make them a little bit clearer?
Sure. So we know that Arizona, especially at this time of year, is a fabulous place to come. The weather is great, so we have a lot of winter visitors. It's also part of our agriculture season, so we have a lot of migrant farm workers. And so we know that our population increases during the winter. We have made that known to our federal partners that we need additional doses to be able to account for this increase in population.
I have another question when it comes to data. It's really important that we understand that we're delivering vaccines equitably. That's a big part of most administration plans to deliver equity. You guys have talked about it as well. How are you making sure to do that? Are you tracking states? How old they are? Where they stay? Zip codes, ethnicity, gender, all that stuff. And can we get that data?
So we're looking at building the website so that it contains some of that aggregate data, because we are monitoring it. When we get into the general population, that will become exquisitely important. So because we won't be doing by priority phases like healthcare workers, law enforcement, and we do want to make sure that it's equitable and fairly distributed throughout the state. So we are going to be watching that. We've got partners that will be communicating with high-risk demographics to, discuss the importance of the vaccine and assist with getting those communities vaccinated.
Yeah, I bring that up because other state capital leads that data, and it's pretty startling. It is not evenly distributed. In fact, one state showed 85% of the people getting the vaccine were white. So our state is quite cultured and diverse. How do we make sure that we don't fall into that same trap?
So that's going to depend once we get into the general population. One of the issues with the studies that were shown was they didn't have the actual demographics of like the healthcare populations and those specific populations that fit in the 1A and 1B group. But it is something that we're tracking and are highly aware of.
President Biden said states would start getting a 3-week heads up on supply. Do we know, have you guys been notified of that? And what is Arizona looking at for supply this week?
So this week, between Monday and Wednesday, we anticipate getting between 160 and 170,000 doses. That's both first and second, and both Pfizer and Moderna. We have not been given our 3-week forecast. We're waiting for that, but what we're assuming is that the amount we got this week is probably stable over the next couple of weeks.
Gotcha. So just to confirm, you have not heard from the administration that they're working on that 3-week supply?
We have not been given a heads up on the 3-week supply. So we have been told about the 16% increase in Moderna, and we're pretty confident that we are going to receive that. What we've been told is that they think it's a pretty steady supply for the next couple of weeks, and then we'll start to see increases with significant increases weeks after that. So there's a lot on the horizon. We know that both Moderna and Pfizer are increasing their production, so that will help as more doses get introduced into the market. But then as new manufacturers bring on new vaccine, that will just add more capacity. So we're very excited. So we are in constant communication with our federal partners. That specific request was denied. We know that all, us and 49 other states are working to get additional vaccine. For instance, we're only doing 500 a day here. This could ramp up very easily to be the capacity of State Farm. So we have the capacity of doing 10 to 12,000 doses here just at Phoenix Municipal Stadium if we had the vaccine. So we've been letting them know we'll take whatever extra vaccine you have because we have the capacity in Arizona. So the partners that we work with are the partners that we've worked with for a very long time. They completely understand. I know that they are advocating on our behalf. They are very proud of what we've been able to do at State Farm Stadium and here at the Phoenix Municipal site. So we know that the ones that we work directly with are, feverishly advocating for us to get more vaccine. Right. So right now we're focusing on building these these mass vaccination sites to get as many Arizonans through as we can. The next phase that we're going to be looking at is smaller sites in communities where people who may not have access to a car can walk up, have it closer. We will also be getting it out into more pharmacies, more doctors' offices, community health centers, so that people can also go where they're comfortable receiving their health care. Yes. So the 64% is the total doses that Arizona has ordered. That's the denominator. The numerator is the number of doses that have been administered and reported to ACES. So we know that reporting lags about 24 hours behind. Today, you'll see that there's a different denominator because now we start this week with new orders. So that will increase and the percent will decrease. But what we're trying to show is the increase in the amount of vaccine that we are using because we'd like to be using 70 to 80% of what we've got in the state each week. So there's a couple of things that we're doing. Steve can get you a phone number where if people have not heard, they can call to get that second dose appointment. Now at the sites that are state-run, we are scheduling the appointments before you leave. So people will have an appointment before they leave. And then at we are reaching out to people who may have been registered under the same email. We have given all of that information to a call center, so please answer if you see that they are calling and have left a message, because they will be able to schedule you for your second dose appointment. Yes, so that happens in 1B. And so these are the essential services that are really, really important. As we get more of our prioritized phase 1B, which is exactly what you were talking about, our law enforcement, our teachers, our child care, and our over 70 or over 65, we will then move on to our essential workers that, the food chain supply, transportation, government, all of those things that keep our community moving. And then after that, we will move into our 1C population. So that will be adults of any age with a medical condition and those living in a congregate setting. So we're still looking into that. At the beginning, the counties have the ability to sub-prioritize and may ask for things like a badge, a paycheck, proof that you work in that industry. as we get closer to 1C, and we're going to, be adding in people who have medical conditions, then we'll be looking at, whether or not we're in doctor's offices at that time or those types of things, because we don't want people carrying their medical records around with them. So what we're thinking is potentially around the end of February, beginning of March. Again, that's going to depend on the vaccine supply and how quickly we can get it out. It could be later than that, but that's what we're anticipating right now. So we're going to be working with our partners to get more vaccination opportunities out into our rural communities in ways that fit them. So things that we're looking at are potentially, vaccination pods where people can drive through, but then also walk-up vaccination events, mobile vaccination events, and really trying to get it out to the pharmacies where everyone goes to get their medication. They can also go to get a vaccine. Our pharmacists do a great job vaccinating a lot of people every year for flu. So we are carefully watching the variants. We have been working with partners that have been doing sequencing around the variants of the virus. We do know that variant appears to be easier to transmit, which could lead to a surge in cases. That's one of the reasons we are so focused on getting the vaccine out as quickly to as many people as we can. But like President Crow said, it's really going to depend. We have to keep doing those same things and can't let our guards down. So we need to mask up, we need to stay physically distant, you need to stay home when you're sick, and really watch out for your friends and neighbors. So our team is currently working on that, and so we're hoping in the next couple of days. Oh, Cameron, okay.
So, obviously, your communities want that vaccine, and I know that you guys are working with the federal government to access more resources for those communities. Last week we touched base. A number of individuals from FEMA had landed on the ground in the state. I think you guys were waiting on counties to request support. What counties requested support, and why not just delegate support to the counties, knowing they're going to need it? Why wait for them to come ask for it? You're going to need it. So here you go. Don't even ask for it. We're not going to require you to ask for it. We're just going to send it your way because we already know you're going to need it. Why not go that way?
No, so that's exactly what we're doing with this request. Even though we don't have as much vaccine as we like, there's actually a federal process in place to make those requests from the federal government. We did not want to wait until we had the vaccine, so we asked them for those vaccinators. Steve can get you the list of those, the counties that will have vaccinators coming to them. And General McGuire, I didn't know if you wanted to add anything about the federal resource request process.
Yeah, Cameron, we've had Pinal County, Yuma County, Coconino County, and Mojave County and Yavapai have all made requests for assistance. If you remember the event at State Farm, I said one of the things we were going to use is that was a teach and train event. So I think what gets lost sometimes is Dr. Chris does all the public policy stuff about public health and how we do response. And then our agency's role is to be the incident management team organizer, bringing in incident management teams from forestry and fire management, other public first responders in communities. Take a site like this, a little bit different than State Farm Stadium, that might look like real estate similar to any place in the county, that we could replicate this. And to the comment about the walk-up appointments, we know that, and the federal requesting process, we know, I think that's in 2 weeks, there's a proposal for walk-up sites like Walgreens and CVS, your local pharmacies, to be able to go into like a minute clinic. So there is some allocation of vaccine right now that's being adjudicated about how much is going to go to public sector state and county drive-through or mass vaccination sites versus retail sites and your primary care docs. So we should have better data on that by the 1st of March. And so that's how that process has been running.
On those retail sites and the pharmacy sites that you're talking about, would that come out directly from the federal allocation? So the state wouldn't be cutting any out of the top of that?
Well, there's only so much vaccine to go around. And so as you may have remembered, about a month or 2 months ago, there was this discussion about my partners on the federal side in DOD managing the distribution through McKesson and other major distributors to direct ship. So for example, today we're receiving direct shipments today for our weekly allocation of Pfizer, and we receive them every week. Same with Moderna. As they begin to direct ship to retail outlets, there's only so many doses of vaccine. So some of the discussion is about how much to allocate to that throughput versus the larger drive-through public sites as we drive in our state to get into 50% of our population vaccinated by midsummer.
Because I know you guys brought up the number to call in case there was the second appointment or they didn't get a confirmation email. Unfortunately, I've had people call that number and they're still not getting the confirmation. A lot of times they don't find them in the system and they say, well, I've got my appointment, I've got the screen, they print off the screen, they submit it and everything like that, but they never received the confirmation email. They've showed up to get the vaccine and been sent away because they haven't found them within the system. We gave them the phone number to call to get that potential confirmation email. However, they're not finding their information in these systems. And I'm hearing this from a lot of people who did it correctly. I mean, I had them walk me through it because I did it myself. So I know they did it correctly, but they didn't get a confirmation email. I don't know what to tell them anymore. I give them the phone number and it's not working. I don't know what to do.
Okay, so that's the first time that we'll take that back and look into it. One of the fixes that we did do that should have gone live on our website today is moving the confirmation button up so that before it was below the screen, so it was very easily missed. Now it will be up at the top in the right-hand corner, I believe, so that people won't miss that and will actually confirm and get it. But I'll take that back and we'll have Steve reach back out to you, Cameron, okay? Okay, perfect. All right. Oh. So as we're looking at potentially where vaccine is sitting around, we're going to try to potentially reallocate it to higher volume sites. So we're hoping to be able to open up appointments sooner rather than later, but it's really going to depend on what we find and what the supply looks like coming in.
When they let you guys buy supplies, remember when they were talking about Pfizer and Moderna possibly selling directly to states? Any developments on that?
We've heard that. We haven't been directly approached, but we've heard the same thing you guys have. All right. So thank you, everybody.
Thank you.